This is Dr. Conless. I'm a primary care physician in Central Florida. This podcast started with only one sole purpose: to make medical information understandable so that it could be used by you in your day-to-day life. We want to avoid the long medical jargon and convert into an easily understandable information so that it's actionable and it benefits from you. Today, we will be starting with a very important topic regarding vitamin B12. There has been a lot of confusion regarding why do we need vitamin B12, what are the different functions it performs in our body, what happens if the level is low, can we have toxicity, what is the daily recommendation, and how we become B12 deficient. I think in this podcast, I will be touching upon and explaining you in a very reasonable way so that you understand what vitamin B12 is and how we could approach. To begin with, let's understand why vitamin B12 is important. Vitamin B12 does many functions in the body, but three are predominantly important. Number one, it is required for red blood cells, maturation and growth. And if you are deficient in vitamin B12, you will develop what we medically call megaloblastic anemia, in which the red cells are big and dysfunctional and they do not carry the lifeline for human beings, which is oxygen. Number two, vitamin B12 is essential for the functioning of neurons in your brain and peripheral nerves. If you are deficient in vitamin B12, you will have symptoms relating to your brain and peripheral nerves, which I will go over in great detail as we go along. Number three, vitamin B12 is required for DNA repair. If you are deficient in vitamin B12, you will develop what we call inadequate or improper repair of DNA, and you age fast and you could develop a lot of medical problems. There is one more vitamin which is essentially a great mimicker of vitamin B12, that is folic acid. Folic acid can give you all the symptoms which so far I have alluded. So whenever we have B12 deficiency, we always look for folic acid deficiency. Now, why do we become deficient in vitamin B12? In United States, we are primarily meat eaters, and vitamin B12 is abundant in animal foods. Why we become deficient is that we have some problem along the line which impairs the absorption of vitamin B12. Unless you are vegetarian or you use animal products very rarely, in the United States, it's very difficult for you to become B12 deficient. In order to understand the different reasons why we can become B12 deficient, let us understand how our body handles B12 once it's ingested. The process of absorption and preparation for its absorption starts in our mouth. Our salivary glands produce a protein which binds with B12 and stabilizes it and passes on into stomach. In your stomach lining, there is a specialized cells which are called parietal cells, and it produces two very important chemicals which are required for the absorption of vitamin B12. Number one is hydrochloric acid. Number two, intrinsic factor. In the presence of hydrochloric acid, vitamin B12 binds intrinsic factor, and this complex is passed down to small intestine, where it is acted upon by pancreatic enzymes and is eventually delivered to last part of small intestine, which medically is called terminal ileum, is the place where it is absorbed. So you see, the problems of vitamin B12 deficiencies could be starting from your oral cavity with problem with salivary glands, problem with your stomach, and parietal cells where you don't produce acid and are deficient in intrinsic factor, or you are taking certain medications which are decreasing acid production, or certain diseases of the stomach which lead to loss of intrinsic factor and eventually vitamin B12 deficiency. Last part of intestine, which we call terminal ileum, and if you have any problems involving terminal ileum, you could have B12 deficiency. One of the biggest reason are young people are getting B12 deficiency is due to gastric bypass and different similar procedures which involve stomach surgery, because you will lose acid and intrinsic factor. Diseases of terminal ileum are celiac disease, Crohn's disease, ulcerative colitis, chronic diarrhea, and malabsorption. In the stomach, as I mentioned, the acid and intrinsic factors are required. If you are routinely taking acid reducers for different reasons, including gastrointestinal reflux, you are at higher risk for developing B12 deficiency. Further, certain diabetic medication, especially metformin, leads to decreased absorption of vitamin B12. So, if you're diabetic on metformin, you are at increased risk of developing vitamin B12 deficiency. Now, what are the symptoms of vitamin B12 deficiency? As I mentioned, vitamin B12 is required for proper functioning of red blood cells and proper functioning of your nerve cells and DNA repair. So most of the symptoms which are easy to recognize after this arise from these three areas. Let's discuss about red blood cells. When red blood cells are not functioning, your body is not getting enough oxygen and your body is deprived of oxygen. So you will get generalized aches and pains, you will be tired, you'll be irritable, you can get muscle cramps. Further, because your body is not getting enough oxygen, your vital organs including heart and also your respiratory tract has to work harder, and it will lead to shortness of breath and palpitations. Further, due to lack of vitamin B12, and there are certain chemical changes which leads to increased level of homocysteine, which can put you at high risk for B12 deficiency and also for cardiovascular disease. Number 2, the nerve cells in your spinal cord and peripheral nerves can lead to symptoms like numbness, tingliness, pain in the nerve areas, which are usually very impairing and shooting, and also other non-specific symptoms which are hard to categorize. When your nerve cells in the brain are not getting enough vitamin B12, you will be irritable, angry, less focused, and also you could develop anxiety, depression, and in extreme cases, you could start losing your memory. One thing which is very important to understand that this process is irreversible if you let it go for a long time. In most of our patients, if vitamin B12 is recognized early enough and is replaced, it is fully reversible and you are not left with any kind of long-term consequences. Now, how do we diagnose B12 deficiency? Vitamin B12 deficiency is very simply diagnosed by the blood test. Most of the time, your primary care physician, if you are above the age of 50, will do vitamin B12 level routinely. Many times, if the vitamin B12 is low, you will be started on replacement and you will never get any symptoms. But in some cases, we also do certain other blood tests. As I mentioned in the beginning, whenever we check B12, we will always check red blood cell folate level. Further, we also check sometime two other tests which are called homocysteine level and methyl malonic acid. In 99% of the cases, we do not have to do these specialized tests, as once we replace vitamin B12, these markers very predictably go down. Sometime in difficult cases when we are not sure that it is being replaced adequately, we may follow these markers which are homocysteine level and methylmalonic acid, which will go down as we continue to replace vitamin B12. Further, how much vitamin B12 is needed? I think before I answer this question, we need to understand how much vitamin B12 is present in our body. Liver is a storehouse of vitamin B12 and it stores about 3 to 5 milligrams to meet our day-to-day needs. Our body loses about 1 microgram of vitamin B12 on daily basis. Once we ingest vitamin B12, only a tiny fraction of it gets absorbed, as it's a very complicated process. But to replace 1 microgram of biological active vitamin B12, you need to have 2.4 micrograms being replaced in your body. You have to consume about 50 micrograms on daily basis to have absorption of 2.4 micrograms of vitamin B12. Sometimes it's very difficult to take a pill every day, especially when the symptoms of vitamin B12 deficiency are very non-specific. It has been tested and proven that if you take vitamin B12 once a week in the dose of about 1000 to 2000 micrograms, that will suffice to meet your daily needs. I have been asked by many of my patients whether they could overdose on vitamin B12. Till today, there is no evidence that you could overdose yourself with vitamin B12. There are multiple formulations are available. If you are a meat eater, then you should not develop vitamin B12 deficiency. If you're vegan or eat meat rarely, you should consume and or buy foods which are fortified with vitamin B12. I hope this podcast helped you and you will get benefit from it. Please do not hesitate to write comments so that I understand the value of this content and it helps me to continue to improve. Thank you very much.